The president's health care law has been taking some hits for several months now. Big revelations that raise questions about the future of the law. Today, more news. Another big insurer is bailing, and website security is still flailing. Correspondent Kevin Corke is at the White House looking at the growing problems with ObamaCare.
Vulnerable to fraud. That's what a government watchdog group says about the Affordable Care Act, ObamaCare. In a report released Monday, the Government Accountability Office said its investigators were able to get taxpayer-subsidized coverage for fake enrollees despite brand-new safeguards against fraud on the insurance exchanges. 10 applications in 2015 and 12 more in 2016 that were fakes were not caught by the administration screening process. In fact, 4 fictitious applicants who got private coverage and subsidies and testing back in 2014 were successful once again in 2016, even though none of the so-called enrollees had filed a 2014 tax return as required. Lawmakers on Capitol Hill were incensed.
I'm not surprised by the fraud, because even though here it is 4 years later, the training wheels should be long off of this thing, but we already know Obamacare is failing on every promise, you know, from lower health care costs to plenty of doctors and hospitals to see, plenty of choice, all of that. So why would they keep the promise that your dollars would be used wisely?
Administration officials called out the GAO for not doing enough to help solve the problem. Aaron Albright saying in a statement, "We have repeatedly requested and remain disappointed that we still have not received specific details or recommendations from the GAO relating to their fraudulent applications." The debate over the security of the exchange comes as the final open enrollment period of the Obama presidency is set to begin. While new census figures show a significant drop in the uninsured rate in this country, down from about 42 million in 2013 to about 29 million in 2015, the number of Obamacare co-ops continues to crater. New Jersey's will fold in 2017, making it the 17th out of 23 such systems to shut down. President Obama, who made an in-person plea to insurers yesterday, also penned a letter to companies offering 2017 coverage on the marketplace. In it, he acknowledged that, quote, "We know that this progress has not been without challenges." And in its own reporting, the House Energy and Commerce Committee is accusing the Obamacare state-based exchanges of wasting hundreds of millions of taxpayer dollars. Specifically, 4 exchanges, they say, wasted more than $239 million on IT work alone. Brett?
Kevin Corke live on the North Lawn. Kevin, thank you.